Hello, doctor. Welcome to DC Conversations. Tell me, we've been hearing of COVID cases again. You think COVID is back?
I think if we think about how the COVID virus is, it's a virus. And viruses are always kind of floating around in our environment. They're a byproduct of just the kind of, being in this century and being in this day and age. So I don't think COVID ever went away. But yes, what we are seeing is the strains are coming back and they're kind of contagious and it's still giving us that similarity to how it was before. But I don't think we will be seeing a full blown pandemic like what we have seen before, simply because now more people are vaccinated, more people are better aware. So the hope is that it doesn't go to a pandemic.
And also, I think for adults, it's quite, I think they're taken care of. How about kids? How do you think parents can protect their kids from the rising COVID cases in India?
So you're correct that adults and who are healthy, especially, they're not affected as much. It's more the at-risk populations. So it's children, and then of course it's older people also who are equally affected. For children, especially, we need to remember that under the age of 2, we don't want to use masks because actually it's a choking hazard for kids. If the child is over the age of 2, then masks are a good option, especially in crowded environments when you're mainly traveling. Because if you're in a flight for a long period of time, that air is constantly recycled. So in these kind of cases, a mask is a good idea. For children, unanimously though, no matter their age, hand washing, cough hygiene, these are good points that we need to take into account. And the fourth most important thing is definitely the child's lifestyle, because immunity is a byproduct of our own lifestyle. So make
Yeah.
sure that they're eating more whole foods, they're well hydrated. And two things we don't take into account is the gut health. We want the child to have a strong gut health, so including probiotic rich foods in their diet, things like curd, buttermilk. These are good, easy solutions for people to add. And then the fourth thing and the most important one is their sleep. Because if the child is not having a restful, uninterrupted sleep, then their immunity is going to take a hit, and that's when more infections come in.
Talking about kids getting not getting enough rest. There have been some post pandemic has caused pediatric health has become a bit of a concern post pandemic, because the screen time has increased because they have stayed indoors. And then there are, a few people have suffered anxiety issues, and of course, immunity has taken a hit. So, how do you think parents can navigate these challenges, to ensure to ensure long-term well-being of their kids?
Absolutely. And I think that's really why I do what I do, because I do recognize that modern parenting has its own challenges, which previous years of parenting did not have. And like you rightly said, that it's screen time, it's more mental health conditions. All of these do play a role in how children grow up nowadays. With regards to screen time, I think one of the most important and overlooked parts is that children imitate parents. So if
Yeah.
parents are going to be on their screen in front of children all the time, it's very difficult to actually then tell children that, oh, you should not be on a screen, because they're learning by what they're seeing around them. So
Yeah.
we can't really have them siloed away from that part. So of course, parents do want to use screens. I totally understand it. Try to do it when maybe your child is sleeping or, is playing somewhere else, and you don't actively do it in front of your child. You give your child 100% of your attention when you're in front of them, especially if you have come back home from work, because these are pockets of time when children are most kind of receptive to their parents' emotions, their parents' connection. So we want to make the most use of that.
Think about things that are affecting kids. Also, there are these lifestyle factors that have contributed to early puberty in kids. How do you think parents can actually intervene and take some early support to ensure that child's overall development?
Early puberty is a very multifactorial problem, and the seeds of it are sown even before conception. So now we're seeing women have more and more PCOS, more and more women are kind of taking help for PCOS as well, right? So there's something kind of incorrect even within their own lifestyle, which is leading towards getting PCOS. And a lot of it is beyond our control. It's in the food we eat. It's in the pesticides that are used over our food. It's in how food is delivered to us, for example, when we order it. The ingredients that are put in our makeup and in our cosmetics and in the creams we apply. So some things are beyond our control. There are some things those which are still within our control. So if we were to think about it pre-conception, it's all about taking a look at how many EDCs or endocrine disrupting chemicals are present in your environment, which are modifiable. So simple ones are like take a look at the lotion you're applying. Ideally, it should be a non-fragrance variety. Take a look at how you're storing your food. Try not to use plastic, especially for hot food. Don't heat hot food and pour it in a plastic container. And these same practices then move into pregnancy and even once you have a child. You want to make sure that you're starting them early so they're also habits for you. And they will not only benefit just the mom, but also the child. And that's one of the biggest causes of early puberty. Another one, of course, is obesity, because adipose tissue also kind of helps promote a lot of production of estrogen. So it does cause early puberty as well. So again, that's another kind of lifestyle related condition that we need to address as well.
Like you said, probably during pregnancy they might even take a few precautions to ensure the child's well-being. But what happens is invariably most women are working these days and they may not have that kind of time to focus on their child, right? So this has led to an emotional guilt among mothers today. How do you think they can actually balance parenting and professional life without burnout?
One of the most important things that we need to recognize here is that the fabric of Indian society is changing. More and more women are entering the workforce, which has not really been done in the past. Where this is kind of what we're seeing now is the highest percentage of women who have worked a formal 9 to 5 job. So, of course, the family environments are shifting. Of course, then there are more nuclear families, more urbanization. Companies need to be the ones to recognize this. They should have more options for where women can perhaps breastfeed safely, where women can work from home maybe thrice a week and come to work twice a week,
Yes.
where better maternity leave is given, where there are more incentives or more support for women who are moms now. Um, and I think when the workforce starts supporting women, we're going to see more women thrive in it. Because when we think about maternal guilt, it's not only impacting how her child is developing, it's also impacting her ability to do the work that you're hiring her for. So the company has to be supportive of that. And I mean, the hope is, and we are seeing some positive shifts in a lot of companies now who are giving better maternal health um, provisions, but it's still not ideal and it needs to be made better. Only then can we really dissociate and, leave this word out of maternal guilt, mom guilt. Like it's just so pervasive in the conversations that I had today. In every office, in every conversation with friends, most women are having it, but it shouldn't be that way.
Talking of which, can you tell us more about your 360-degree model for child health care and how it perhaps empowers parents to raise healthier and happier children?
So I'm a pediatric lifestyle medicine. I did my MD in pediatrics and then I went on to do lifestyle medicine, which is really the study of how our behaviors and environments shape us and shape our trajectory of chronic diseases. But when we combine the two, or when I combine the two, I think about it more so from the perspective of how can we help raise children who are happy and healthy in the 21st century in a world which is changing far too rapidly. So think of me almost like a support system for modern parents, whether it's conversations about nutrition, sleep, mental health, even psychological support, brain development, gut health. There are so many different aspects of it, even preconception, like epigenetics. So there are so many aspects of pediatric lifestyle medicine, but the final aim, if I were to kind of capture it in one sentence, would be that what can we do better in childhood so that these children don't go on to develop chronic, non-communicable diseases. For
Yeah.
example, things like diabetes, obesity, and then even mental health conditions, which are silent and they're quiet, but they're kind of detrimental to a person's quality of life.
Thank you, doctor. Thank you so much. Thank
Thank you so much. Thank
you.
you. Thank you.